So, but listen up. This is an important component of this project. Dr. Jeannie Miranda.
Hi, I'm Jeannie Miranda. I'm a clinical psychologist from UCLA, and I specialize in treating depression in low-income individuals.
Hi, I'm Michael Hong. I'm a general internist, practicing primary care provider at UCLA.
Hi, I'm Vicki No. I'm a clinical psychologist. I work at Rand and UCLA. I also do research with ethnic minorities and also in Vietnam.
Good morning. My name is Craig Landry, and I'm an MSW, a social worker. I'm also in the PhD program of social work at UCLA.
So I will give you a little introduction to collaborative care for depression and then pass it off to these folks to talk about the separate issues. Yeah. I have to say, coming here this morning, I got a real education, once again, about what collaborative care is about. I had some work I had to do in my office early this morning, and Irma and I were on the freeway, and we got stuck in really bad traffic, and I was looking at my watch and wondering if I was going to get there. And at first I was very anxious, and then I realized, any one of these people could do what I'm doing in a second, because collaborative care means that everybody knows the plan and everybody can work together and really cover for each other and give the people that we're trying to treat who are depressed one view of how to get better, because we all know each other's roles. So it would have been very easy for me to call any of these three, and they could have stepped up and done my part immediately. So that's really what I think collaborative care is about. It's an approach that was developed in primary care settings, where we found, early research found that a lot of people who are depressed don't ever get to psychiatry. And it kind of makes sense, because when you're depressed, you feel really bad, and your body feels bad. So people often, their first place to go is to their primary care doctor to try to figure out what's going on. There's a lot of resistance and concern about getting specialty psychiatry treatment, so I think people feel comfortable in primary care. But we found that people were even when you could identify them, they weren't getting better in primary care. So a physician might identify that they were depressed, but then not quite know what to do, or prescribe medication, and the average use then was one pill. But people would take one and have a side effect and not know what to do, and didn't have a follow-up appointment and didn't get a lot of follow-up care. So we really found that you need a team in primary care to do a good job. So together we're trying to move the concept of this collaborative care into the community. So rather than just primary care in the community, can we bring resources together in the community to help meet the needs of depressed folks? And an important area of depression is really patient education. People really don't know. We did a large trial of treatment of depression in Washington, D.C. area in low-income women, and one of the things that they told us over and over again is, if you hadn't told me, I wouldn't have known I was depressed. I know I don't feel very good, but my mom was kind of like this, and a lot of my friends are like this, and it just seems like if you're living my life in this poor community, that's what you would feel. Not that I have something that I could get help with. So there's a huge amount of need. And then if I do get help, what kind of help would I need? People are concerned, if I take a medication, I'll get addicted to it. Antidepressants aren't addictive. So there's lots of ways that patients can really benefit from education. So collaborative care brings together mental health professionals who may do a treatment, or they may just advise primary care doctors, and care managers who form a team. And remember, part of the reason that you need a team for depression care too is the symptoms of depression. Unfortunately, the symptoms are to be not motivated, to not believe anything is going to help you, to be really demoralized. So people who are depressed need that extra, the care management piece, of someone who can really help them overcome all that negativity to try the treatment. So this, basically, we think that community, there's a lot of place for community lay health workers to get involved and help. Clinical social work and psychology can do evidence-based treatments. primary care certainly has a huge role in being able to provide medications and support and referral for depression treatment. Psychiatry has an important role for people who don't get well on a first medication. Oftentimes help from a psychiatrist is incredibly useful. Social services, I think one of the places that you can detect and refer people is really in social services, where people are still being seen and there's high rates of depression. So working with the community and all these organizations, we hope to put together a really useful care package for this community. So what does the team do? They really help identify those who are depressed, help educate them about depression, help them get care that works, and that's really important. There's a lot of care that probably might make people feel a little bit better for the day. If they go to a neighbor and talk to them, they're going to feel better, but they probably are only going to feel better that day. They might wake up the next morning still depressed. So we really want to get them the kind of care that works and link it all together and then follow them over time. So with that, I will pass it off to Michael Long to talk about the primary care piece.